differences. First, I would like to introduce our guest. Our guest is Professor Morris Grubbs. Yeah, I'll try to do this. Thank you very much. Okay, so the outline for today. First, we are going to introduce our guest today, Professor Morris Grubbs. He is Assistant Dean for the Graduate School. He is the Director of the Graduate Student Professional Development and the Director of Graduate Certificate in College Teaching and Learning. And our topic today will start with a refresher about health, what's meant by health, back again to our very first lecture in our course. And we would like to discuss what's public health from the perspective of health. Then we would like to go further to talk about international health and the differences between public health, international health, and global health. Then we will watch a short video about global health and discuss some of the global health issues. And finally, I will share with you some snapshots of my experiences in international health and global health. First, what's meant by health? Health, according to the World Health Organization Constitution, published and signed in 1948, is a positive state. Actually, health, according to the World Health Organization, is not merely the absence of disease or infirmity. It's a positive state where people have complete physical, mental, and social well-being. So, what's public health? Public health, actually I like the very first definition of public health of Hansel. In 1920, he stated that public health is a science and art. Remember, it's a science and art. And we are mixing sciences, multiple sciences and multiple arts in public health because it's a social phenomenon we are going to talk about. So, from the definition of health according to the World Health Organization, we can say it's about preventing disease and more positively prolonging life, promoting physical health and efficacy, and this is all through organized community efforts. Adding to this definition of public health, we have this landmark report of the Institute of Medicine, Future of Public Health in 1988. In this landmark report, they added very important component to public health, which is the mission of public health. The mission of public health is about people can be healthy, fulfilling society's interest in assuring conditions in which people can be healthy. So, again, how can we think about public health? We can consider public health in ocean at the current state of public health. What is the current state of public health now in the United States or in Kentucky? And you can think about public health as a science and art, combination of sciences, skills and values. And also you can think about your ultimate goal, which is healthy people, promoting health, prolonging lives. And finally, you can consider public health as collective social actions, organized social actions through organizations and community participation. So, we are going to differentiate between public health, international health, and global health according to the scope and the solutions for each one of them. So the scope of public health is health problems of particular community or country. As we have here in this map, we have public health issues in Kentucky and public health issues in the United States. They are all together related to the communities and the local context of the United States. Accordingly, the solutions for the public health issues in Kentucky and the United States, they are available and achievable by the local efforts within the United States and maybe within Kentucky, like the organization leading public health efforts in Kentucky, Kentucky Public Health Organization, which is called Kentucky Department for Public Health. Accordingly, we would like to stress on the scope of public health is health problems, particular community or country, bounded by the boundaries of this context and this community, and most of the solutions are available by local efforts. So what's international health? What's global health? Let's go for this short video, which is titled, What's Global Health? It will give you an idea about the differences between the scope and the solutions for every one of them.
The spread of HIV, the SARS and avian influenza scares, and the recent Ebola outbreak have all brought attention to global health. But what exactly is global health? The most widely accepted definition is that, with justice and human rights as its foundation, global health is an area for study, research and practice that places a priority on improving health and achieving health equity for all people worldwide. It should not be confused with international health, which focuses on developing countries and foreign aid. There are now more than 100,000 international flights every day, which means more complex infectious diseases spread beyond national borders more quickly than ever before. Individual countries don't have the capacity to tackle these ever-evolving threats by themselves, which means that people from different governments, cultures and religions have to work together to keep the public safe. But global health isn't just about infectious diseases. It's also about fast food culture that contributes to obesity, diabetes and heart diseases, girls' education that leads to lower child mortality rates, poverty that keeps people from affording basic housing, food, education and health services, the ever-growing flows of goods, money, technology, knowledge and many more that have implications on our health. In global health, we try to understand the underlying causes of these issues, whether they are social, cultural, economic, environmental, political, behavioral or biological factors. We look for solutions that cross boundaries between disciplines, sectors and societies and ask people to implement them jointly. Engineers, teachers, business people, parents, politicians and many other professions working in governments, civil societies and the private sector. Global health thinks about the entire human population as one global community, and it seeks for this community to work together to stay healthy. It believes that everybody should be concerned about the well-being of their fellow humans, and that we should all take responsibility for health issues no matter where they occur or who is affected. How do trade agreements affect people's health? What is the impact of urban planning on health and well-being? Does migration represent a threat to health? In what ways will climate change affect our health? What are the challenges for an aging population? Whose voice counts in global governance? If these questions excite you, join the Global Health team. It needs diverse people like you to work together to find lasting solutions. Thank you for watching this minute video series on global health, which was made in collaboration with the School of Global Studies at Thammasat University.
Okay. Any comments, any thoughts about this video? Do you think now you have an idea about the differences between public health, international health, and global health? Thoughts, comments about this? Okay, let's go for the next concept, which is international health. Again, we are stressing on the same elements. We are going to differentiate between international health and public health according to the scope and the solutions. The scope of international health is health problems that affect population in low, middle-income countries and commonly known as developing countries. And these solutions for these health problems are usually available and achievable by binational corporations and foreign aid. In this map, which is classifying the world countries by World Bank classification by GDP, gross domestic product, into high, middle, and low-income countries, we can see here in the map, we have some health problems in the developing countries, mainly Africa and Asia and in South America. These low and middle-income countries need support from high-income countries to achieve their health goals. Like here, the United States is providing some sort of support, capacity building for the health systems in low and middle-income countries in binational cooperation. This is international health. So, what's global health? Again, we are talking about the scope and about the solutions. Scope of global health problems that cross national boundaries and they require global collaboration. Do you have any idea about the topics of global health. What are the global health problems that you know? Any ideas? Any health problem that you know that this is global health problem? Global health epidemic? Zika virus?
Like
Yeah.
it comes from Costa Rica and goes as far north as like New Jersey or Connecticut.
Okay, perfect.
And Ebola as well.
Ebola as well. This-
Both.
Yeah, both of
Within
them.
2014.
Okay, these are the most recent global health issues that's bringing attention of everyone in the world. Ebola and Zika, they are epidemics, started somewhere in the world, and they started to transmit to different countries in the world. So nobody is immune. Nobody in the whole world is immune from Ebola and Zika. They are traveling with people. As Ebola, when Ebola started in West Africa, in Guinea, in Sierra Leone, and in Liberia, and now it's traveling, transmitting with people who are traveling from these areas, coming back home in the United States and in different regions. The same is for Zika. Zika virus started in Latin America, in some regions in Brazil, and some other countries, and started to transmit to North America, and we still have now, we have now some cases of Zika in the United States, in Florida, and some areas of the United States, traveling with people. So, the first example for global health issues are the communicable diseases, global health epidemics, like Ebola and Zika virus. These is within the scope of global health. So what are the solutions? Solutions for global health issues needs global collaboration. And this is what's actually happening in the Global Health Security Agenda. The Global Health Security Agenda, launched in February 2014, is a partnership, global collaboration between over 50 nations, international organizations, and non-governmental stakeholders. This is under the patronage of President Barack Obama. Again, we are stressing to the point, global health issues needs global collaborations, and this is an example. The aim of this global health security agenda is to help build countries' capacities, supporting the health systems, strengthening the health systems in West Africa and in Latin America to tackle these global health epidemics. For a world safe and secure from infectious disease threat, and to elevate global health security at the national and global prioritization of global health issues is very important to bring the attention and support of all countries around the world for strengthening health systems in these areas where the global epidemics start. But as we saw and watched in the video, global health issues are not only about infectious diseases. In the video, we have this example, which is talking about the food culture. The food culture which started at junk food, the takeaway food, and fast food culture is transmissible by the diseases, which is Ebola and Zika virus. This is transmissible to everywhere in the world. Actually, what you get from McDonald's or whatever you are going to get away food here in the United States is happening everywhere in the world. And this is contributing to obesity. Again, we would like to talk about some of these non-communicable health issues as global health issues. One of the most important global health issues is global warming. Did you hear about global warming before? Any of you hear about global warming? Okay. So what do you know about global warming?
The sea levels are rising because the polar ice caps are melting in the Arctic.
Okay. So
And like coal power plants also rise because the CO2 levels
okay.
are going through.
Okay. This is actually correct. There are some changes in the environment of the world which is contributing to changing the world environment and resulting in raising up of the temperature of the world. The exact definition is rising the global average temperature near Earth's surface, caused mostly by increasing concentrations of greenhouse gases like CO2 or CO in the atmosphere, leading to climate patterns to change. And this is leading to climate change. Climate change is defined by any significant change in the measures of climate lasting for an extended period of time. They are all contributing to one thing: the temperature worldwide will be changing. What do you think will happen if the temperature of these cold countries in the northern hemisphere will be changed and will be elevated? Do you think there will be a change in their health problems? Areas. Okay, let me give you a hint about this. We know that there are some tropical diseases. If you remember the epidemiological triad: environment, agent, and host. For any agent needs an environment favorable for flaring of this agent, so this agent will be a transmissible disease, like malaria, and like all these tropical diseases. If the cold countries in the northern hemisphere experience higher temperature, they may be facing new kinds of diseases, like malaria and other tropical diseases. This is why we think about global warming. Global warming will change the environment, and this may lead to the emergence of some kind of new diseases in cold countries. And this is a photo for, I don't know if you know this guy, I know him very well. And this is Leonardo DiCaprio, and he is climate change advocate, he's global health advocate. And this photo was in 2014. He was giving a talk in the climate change summit in New York, and he is very powerful in this issue, and he is against the new president, the president-elect in these climate change issues, and he is starting now to advocate against the climate change hindering efforts of the president-elect. Another topic from the global health non-communicable issues is urbanization. Did you hear about urbanization? Did you hear about this term before? Urbanization? Okay, so what do you know about urbanization?
Is it like the rapid increase of development in areas? So maybe a lot of a rapid increase of population,
Okay.
Development in areas.
Okay, this is close to urbanization. Urbanization is about changing the environment where people are living. We have urban areas and we have rural areas. And we have some issues related to rural areas and to urban areas. The transmission from rural to urban in an inorganized way may result in production of some sorts of communities, what we call slums. And these slums, they have very weak infrastructure and they are overcrowded, as you are saying. And this may result in some health problems. And usually they have these bilateral health problems. Rural health issues and urban health issues are combined in one place. And this is very high burden in public health. Urbanization is happening everywhere in the world. And it's related to migration. Mostly it's about internal migration within the country. If you don't have good infrastructure and urban planning, most of those people who are traveling from rural areas or migrating from rural areas, and they are starting to build their own communities with their weak infrastructure, they may have the suburban areas or these slums. And these slums are characterized by special health issues. Let's go for the definition. This is a scientific definition of urbanization according to the World Health Organization. It's a process of global scale changing of the social and environmental landscape in every country, and it is inorganized. Urbanization is a result of population migration from rural areas, and also it's a result of natural urban demographic growth. Also, if you have urban area and it's well structured and we have good infrastructure, but the population is growing, so we have high burden with the infrastructure, inorganized buildings. People are living in housing conditions like rural conditions or inorganized slums, as we can find in developing countries. Health issues related to urbanization, solid waste disposal, all these issues are related to the infrastructure and they are affecting health. Solid waste disposal, provision of safe water and sanitation, injury prevention. We have a lot of injuries in these areas. We don't have good infrastructures. We don't have good transportation and roads. We don't have paved roads, well-organized roads, so they will have a lot of injuries. And also the interface between urban poverty, which is urban, environmental, and health issues, and also these are related to rural poverty. So we will have a double burden of urban and rural health issues. Other types of health issues in the global health realm are the health issues which need solutions beyond the capacities of communities and beyond the capacities of countries, like the poliomyelitis eradication program. The poliomyelitis eradication program, although polio is still happening in few countries in the world, we have a list of few countries, but this is beyond the capacity of these countries. And this is a threat for their health in the future, because usually poliomyelitis happen to children at very early age, and it leads to disabilities that will accompany this child for his life. So, to eradicate polio, we have the Polio Global Eradication Initiative, supported by the World Health Organization and the UNESCO, and the UN organizations are collaborating with the countries, different countries of the world, against poliomyelitis. This is a global health issue beyond the capacities of the countries which have this disease. Also, the Middle East migration crisis. If you hear about the Syrian war, the civil war in Syria, this is affecting the migration map in the Middle East and in Europe. People are migrating or fleeing this conflict, and they are going to the sea, Mediterranean Sea, seeking refuge in Europe. And this is not only related to Syria, it's affecting different countries. And this impact in different countries led to giving this health issue the profile of a global health issue, which needs collaboration between different countries in the world. So, do you have any questions, any comments, any clarification about what we're talking about? It's clear now that we have three concepts: public health, international health, global health. They are different from each other according to the scope of health issues and the solutions available and the collaboration level of these solutions to solve them. Okay, let's start by some international health activities that I have. And when we talk about international health, usually we talk about bi-national collaboration. And I'll give you an example from a medical convoy that I was coordinating in 2012 between Egypt, my home country, and we provided surgical services for Burundi. And this is Hospital Prince Rwagasore in Bujumbura, Burundi. And this was part of our team with the director of the hospital. Here is the director of the hospital inside this big circle. His name is Dr. Manina. He's a medical doctor and he has massive public health. Remember this guy, he will come later in our lecture. So at this point of time, we are providing through a bi-national agreement support for the health services in another country. Egypt is considered as a high middle income country. Low middle income country. And Burundi is considered low income country. So we have a collaboration between two countries with different capacities to support each other. And this is a nice photo with some guy I found in front of the clinic. They told me, Muaz, he looks like you. So I told them, okay, he looks like me. We have the same bald head. I don't know if this light is reflecting on this photo. But usually, when I find someone who looks like me, I take photos with him. He was a very nice guy. But he was looking in a very sad way to the photo. And this is a group of nice people. They are waiting in front of the hospital for some services, and they were laughing at me. They thought I'm wearing very strange clothes, I don't know, it's prospectively. So At this point, they were laughing at me, what's he doing and why he's sitting here? They came and sit beside me. Anyways. And this is another photo. This young man, he was going into minor surgery and we're trying to calm him down. I was smiling like, okay, it's very silly smile anyways. But this guy was very afraid and his mother was trying to calm him down before this minor surgery. He didn't know what actually we were doing, but he was afraid because we were strangers. But it went fine. And I'd like to share with you some global health activities. So global health, again, the scope of global health, health issues which are affecting every human being in the world. And the solutions for those issues require global collaboration. One of the programs I'm participating in is called the Young Physician Leaders Program, fostering new generation for leaders in global health for the 21st century. And I had this program the first time in 2012, and this is photo for our group, our team, and our coaches. One of them is from here, from the United States. This lady, this is the president of New York Academy of Medicine, Professor Jo Beaufort. She is a professor of health service and management. She is working global health and pediatrics. And she is our coach. And this is Dr. Vianten. He is the former and owner president of University of Charité in Berlin. And he's a physician as well. And he's working global health. And both of them gave us some good ideas about how to be a public health leader or global health leader. Another activity I'm participating is Global Health Think Tank. So the Global Health Think Tank I'm participating in, we call it One Health Global Think Tank for Sustainable Health and Well-Being 2030. Remember, we are talking about the scope and the solutions. The purpose here to bring together global multi-sectorial, multidisciplinary thought leaders. These are one of our approaches for the solution. It should be collaborative solutions, multi-sectorial, multidisciplinary solutions for sustainable planning and people health and well-being. The mission is to contribute to the implementation of educational health goals within the UN Sustainable Development Goals. Did you hear about the SDGs? Any of you heard about the SDGs? First time to hear about Sustainable Development Goals. So, did you hear about UN Millennium Developmental Goals, MDGs? Okay, you hear about it?
I heard that last semester.
Okay.
So about the UN stuff.
Okay. So, what do you know about the Millennium Developmental Goals?
Like, helps teach this generation about the global health.
Okay. So the UN developmental goals, either the Millennium Developmental Goals or the Sustainable Developmental Goals, they are actually aiming at capacity development of different countries in the world, especially the developing countries, in order to improve their health and developmental pillars like education, poverty. We'll come later for Sustainable Development Goals in the next slide, but I would like to stress on our mission for Sustainable Developmental Goals, including education and health. We are using an international, again, interdisciplinary, multidisciplinary, transdisciplinary, global One Health approach. Again, the solution is a collaboration between different people from different parts of the world and among different sciences and disciplines. These are the Sustainable Developmental Goals of the UN. When you look at the Sustainable Developmental Goals, Developmental Goal number 3, it's titled Good Health and Well-Being. We have 17 goals. One of them is explicitly about health. Good health and well-being. But if you think carefully about these other goals, they are all contributing into health. They are all closely linked into health. When you think back about your research paper, in your research paper you are talking about disparities, risk factors for any disease. When you look at these disparities, you'll find that the socioeconomic status of a human being is very influencing for his health, for her health. when you think about the poverty, education, all these determinants, they are contributing into health. And this is why the World Health Organization views sustainable developmental goals are all linked to health. They are putting the third goal as the main one, which is good health and well-being, by ensuring healthy lives and promoting well-being for all at all ages. Again, the World Health Organization is going back to the Constitution of 1948. It's about positive idea of health, promoting health. But also, the World Health Organization, in these developmental goals, are putting every goal within the perspective of health. Actually, this is very small for you, can't read it, but you can go back for the Sustainable Developmental Goals, WHO website, and you see that poverty, gender equality, all these goals, they are closely related to health.
I have a question.
Yeah.
Are those in order of importance? I mean, they have
No.
numbers on them, or are they just...
No. Actually,
17
I think
goals?
they are not well organized. If you go back, they are starting with no poverty, zero hunger. They are not well organized, but they are not in order, actually.
Okay.
But actually-
That's just the order that they decided to put up
I
in
would
the
say the
goals.
Millennium Developmental Goals were better organized. And even the indicators within the Millennium Developmental Goals were better than these indicators. They were very high, they put the bar very high, like for maternal mortality. For instance, they are putting an indicator for maternal mortality, which is reducing maternal mortality by 50%. This is very high in developing countries, but it was very organized. Here you are talking about no poverty, related to health. Okay. Zero hunger, again, it's related to health. If you are talking about nutrition, this is a simple idea. If you are talking about quality education, education is related to health. Gender equality, clean water and sanitation. Remember, we are talking about urbanization, water and sanitation. Affordable and clean energy, energy sources. If we have these affordable and clean energy, this will help people promote their lives. And if you don't have clean energy, if you have these coal mining, negative health influence, like the coal mining in southeast Kentucky, Appalachia, this results in health. If I talk about decent work and economic growth, decent work and economic growth will help you by poverty and education. If you improve and alleviate these problems, this will improve your health. If we're talking about industrial innovation and infrastructure, back again, we are talking about determinants of health, infrastructure and urbanization. For example, reduced inequalities in general. I'm thinking, why are we putting reduced inequalities and gender equality? Again, it's repetition. Maybe I'm sophisticated in this. We should be including gender equality within reduced inequalities. And of course, you have written about disparities and inequalities in health in research paper. Also, sustainable cities and communities, back it's related to urbanization and the changes in the environments and infrastructures, responsible consumption and production, rational use of resources, closely related to clean energy, closely related to the next one, climate actions, life below water, life in land, they are all related to our resources, especially water resources, peace, justice, and strong institutions. This is related again to the infrastructure, especially in the fragile states, these developing countries with conflicts, and also partnership with the goals. I would say these goals are repeating themselves. They are not well organized, and I would prefer the Millennium Goals.
So is the UN just working on all of them kind of at the same time through different initiatives, or?
They have different initiatives, and there are different UN bodies working on this, according to their missions. Like the World Health Organization is mainly working on health, but it's communicating with other UN bodies, like the UNESCO or the UNICEF, which is UNICEF is related to the children. So if you are talking about children, we would like to talk about hunger, about poverty, the World Health Organization is collaborating for hunger and poverty of children in developing countries.
Okay.
So different UN bodies, they are collaborating with this. So they are UN developmental goals. Any questions, comments about this? So let's talk about some global health leaders, and I'd like to share with you how these global health leaders are working in global health and how they can share experience with other people on how to be a good global health leader. The first one, I bet you will know him in the second slide. We will talk about one of his achievements. This is Dr. Peter Piot. He is Director of London School of Hygiene and Tropical Medicine in the United Kingdom. He's from Belgium. And he was the founding and executive director of UNAIDS, the UN institution for AIDS, and the Under Secretary General of the United Nations from 1995 until 2008. He was working with Kofi Annan. I don't know if you remember Kofi Annan from Ghana. He was the General Secretary of the UN. I met him in Berlin in 2012, and we had a discussion about global health and public health. He's a very nice person. And here you know who is Dr. Peter. Dr. Peter Piot, he co-discovered Ebola in 1976. He was working with Enverg Institute, and they were working on tropical diseases. He's a biomedical scientist, he's a medical doctor. And he went to Zaire. Now it's the Democratic Republic of Congo, I think its name now. And they were working in Ebola. And he shared with us his experience by saying, at this point of time, you have a very vague disease. People are dying with very strange manifestations. And to help these people, you should enter the community. How can you enter a community as a stranger? And this community, they have a lot of cultural boundaries with you. First, they have to work collaboratively with traditional healers. People from this community who are treating the patients. After their success in this, the traditional healers, they took notes about the manifestations and about the prognosis of these diseases and how these manifestations led into death. From this point, they could enter the community, started to talk with people, get these cases as early as possible, and try to work in discovery of the disease. And he co-discovered Ebola actually in 1976. And after this, he worked on AIDS for a long time. He's interested in infectious diseases. You know, AIDS started as well in Africa and transmitted in the United States in the 1980s. And this is his book he was talking about in Amsterdam academic lab. No time to lose, life in pursuit of deadly viruses. He was talking about Ebola and AIDS all through his experience. He gave me this kind of application for this book. And here we go, another famous person working in global health. This is Dr. Peter Piot, Johns Hopkins. He's working with one of the important global health issues, which is malaria. He's the director of the Johns Hopkins Malaria Research Institute. He's a very nice person. He's Nobel Prize winner in 2003 in chemistry. I told you that I have no idea about the discovery of the acquaint water channels. And when we talked with him, we had this informal discussion about what do you think will help us solve global health issues? He was talking about collaboration. He was saying, if you don't have good collaboration, you will never solve any global health problem. And he was talking about malaria and how they in Johns Hopkins working with different African countries for fighting malaria. He's a very nice person, very humble person, and he's still working with malaria, and he's still director of Johns Hopkins Malaria Research Institute. And here we go. This is my favorite. This is Mike Craig. Dr. Mike Craig is the former director, former dean of Johns Hopkins in the School of Public Health. He's a very nice person. He's a medical doctor and epidemiologist. He just left office a few weeks ago. He's very famous global health figure. And this was the American Embassy in Berlin. And we had discussion about French food, actually. He was not talking about health. And he was making fun of the French chefs and how they are very sophisticated and finding the food is not tasty. He's a very nice person. And this is Dr. Carlos Dora. Carlos Dora is this person. Carlos Dora is a coordinator of public health and environment department of Health Organization. And he gave us a lecture, our reunion of the young physician leaders. He gave us a lecture about urbanization and how urbanization is affecting every country, every community in the world. How people are changing their environment from rural to urban, and these suburban areas and these slums are having special health issues related to water and sanitation, infrastructure in general, and how they have these pollution issues, overcrowding, overpopulation. He's a very nice person, and a very nice person. And this is a boss. Do you know these people? Did you see their face? Of course you can see from the inside. This is Dr. Mary Chan. She's the Director General of the World Health Organization. She's going to leave office in a few months. And probably French candidate is going to take office. And this is one of my friends. Actually, this is not me. He has some here, so I can. So he told me, Muaz, I'd like to take a photo with her in the reception of the World Health Organization. I told him, I'm a good paparazzi. I would like to take a photo quickly with her, but just let her look at the camera for a second. And I took it, and this is one of my friends. She was laughing at me because I was trying to catch the photo. It was really nice. She's a very nice person. Those global health leaders, by the way, they are very funny persons. When you saw them in lectures and in front of the media, they were very strict. This lady actually, few moments before this, she was making fun of someone in one of the head advisory team or something like this. She's a very nice person. And actually, I had a discussion with someone working with her. He told me, when they have an achievement, she usually sings in front of people. Very nice. And finally, we came back to the guy that I met in Burundi. If you can remember this guy inside the Red Circle, Dr. Manina. He was a director of Prince Louis Gazoli Hospital. I met him by accident in the World Health Organization and the same reception. And he was walking around smiling as usual and wearing this nice white suit. And I said, oh my God, this is very small public health program. What are you doing here? Actually, he joined the advisory team for the World Health Organization, Director General. Very nice meeting, catching up about career, how I ended up here in the United States and in academic education. And he changed his work in providing health services in the country, working global health in the World Health Organization. So, my take-home message for today, there are some differences between public health, international health, and global health. But remember, they are all sharing the values of human rights, social justice, and equity. They differ in their scope of health problems and the required efforts and solutions. And global health scope is health problems that transcend national boundaries and affect humans everywhere in the world. Global health efforts need global collaboration. That's it, and I'm ready for questions, comments, ideas, thoughts about this lecture. Thank you very much for listening. Thanks for your responses.